All right. Well, thank you guys for joining. My name is Bilal Ahmed, and I'm a fourth year resident at the University of Iowa. And I'm joined today by my amazing attending, Dr. Jaclyn Haugsdal, who is a assistant professor at the University of Iowa, associate program director and director of surgical simulation. And we are super excited to have you guys join us. Thank you for being here, number one. And we're going to be talking about a really cool topic today that, is very personal to me as a resident who's kind of gone through this learning curve. And hopefully some of you out there are kind of, going through the same thing or may have gone through in the past or are about to start that same journey. So we're hoping that this talk kind of gets us all kind of talking about something that we all will go through or have gone through. And that is kind of how do you transition from the mindset to being a surgeon to being a beginning surgeon, and what does it take to develop the right, skills to get your hands prepared for surgery, and how do you get that microdexterity that's so crucial in ophthalmic surgery in particular? So we're going to be talking about a lot of different things today. We're going to be taking your questions too towards the end of our session, so we can make sure that we can hear what are your concerns or what are things that you're thinking about. And I'll definitely be picking the brain of Dr. Haugsdal, who's really an expert in training resident surgeons from the very beginning in the wet lab to when in the actual OR as well. So we're going to go ahead and get started here. So I first want to share a poll, and I really want to know from you guys where you are in your training. So are you a medical student? Are you a resident? What year in training you're in? So that way we can get an idea of where you are and go from there. All right, it's a pretty even split here. We have some medical students, we have some junior residents, senior residents, some fellows, and even some attendings. So hopefully everybody can relate and take something away from today's talk, and that's our overall intent, and I expect that to be the case. So I already gave the introductions. Like I said, I'm Bilal Ahmed. I'm in my last year of training here and as in residency at the University of Iowa. So for those of you around the world and other countries in the United States, we go through a residency process where you're focused on learning the general scope of ophthalmology. That's the clinical and surgical side of things so that you can graduate and be a comprehensive ophthalmologist. Some people go on to do a fellowship in whatever subspecialty that they want to get a little bit more expertise in. So next year I'm going to be doing a fellowship in cataract refractive surgery and anterior segment. And by way of my a lot of my where I'm at today is because of Dr. Haugsdal, who's trained me, and I'm lucky to be trained by her. And as I said, she's an amazing teacher, and we'll get to pick her brain today as well. So here are our objectives. These are things I really want to break down for us today and kind of guide you through as your moderator. So number one is, what does it mean to develop a growth mindset for surgical skill acquisition? So what's the mindset you need to kind of be able to really ramp up your skills and to approach surgery in the right way so that you can maximize your training and also continue to improve in this lifelong process? For those of you who are in the United States or whether you're not in the United States, what is it, how can you improve your skills when you're at home? And what resources do you have available to you? And no matter where you are to that point where you can kind of get comfortable with your hands when you're operating and you feel like you actually are able to practice something outside of obviously operating on patients so that you can also just be prepared and always do better for your patients. We'll talk about that transition too from when you're kind of in that wet lab stage or the beginning surgeon stage where you're maybe practicing suturing on objects at home or even simulated eyes to how do you kind of transition to when you're operating on live patients, on real people. And then obviously as a surgeon, you're going to have complications. That's part of what we signed up for. How do you deal with that? How do you transition from that and kind of keep going and feeling like you're learning from that? You're making sure patients are safe. But at the same point, you also can sort of find peace with yourself, knowing that you're your best self and how you can be your best surgeon and not compare yourself to others and not feel like you're behind the curve when it's not necessary. So I want to get a sense of what you guys think about this question. Do you think being a good surgeon is based on natural ability? Do you think you're just born being a good surgeon? Okay, so 32% of people say, yeah, some people are just born with naturally good hands. And a majority of you feel that, no, it's something that you can work on and you can grow. And the reason I ask that is because of this idea of a growth mindset. So, for those of you who may have answered yes, you're not wrong. It's not to say that there's, some people are naturally more gifted as surgeons. Some people maybe are, but I think it's more about that idea of a mindset. So If you're thinking, I'm just this way. I have, it takes me a lot of time in the wet lab, takes me a lot of sutures, takes me a lot of practicing on the IC if I have one of those. I have to take a banana home or a grape home and suture that a lot to feel like I'm getting more confident. But I'm just going to peak at some point and that's it. Maybe that kind of reflects that you just think that this is it, and you're born with a certain set of skills, and you'll probably never get better, and you'll maximize that, but maybe that's it. Um, I think the majority of you, I probably agree with you, but I think it kind of fluctuates. Sometimes I feel one way, sometimes I feel the other based off of my day of how operating went. But the growth mindset's really important to keep in mind so that you feel like, there's always a potential of learning and growing, and anything, especially in ophthalmic surgery, can be better. Whether it's not just surgery, but even how the team works together, and even just how the patient is treated from the way they come in to the way they come out of the surgery. So a lot of these opportunities for us to reflect and grow on are hopefully positive things, so we can feel like we can also improve. Dr. Haugsdal, from your experience, working with residents now for several years, from the wet lab, I'm sure you've seen a lot of people who are just naturally pretty gifted with their hands, but people, who maybe accelerate their learning curve or maybe don't have the best hands in the beginning, what have you found them to have successful character traits that have made them really grow rapidly?
Yeah, so this is a great question. And I've thought a lot about this over the years as I've kind of been doing the wet lab. And for those of you that don't know, when I do the wet lab, it's very early on in the residency program. So they've usually done their intern year, which really has very minimal surgical um, time, I guess you'd say, or practice at that point. And so it's usually in their PGY2 year when we'll do the wet lab. And so they have really done very minimal surgical skill practice or training up to that point. So I see everything. So I see all kinds of natural ability, but I also see people that maybe just don't feel like they're as natural. And then I see all kinds of confidence issues. There's people that are very confident with their skill set, and there's people that are not very confident. But I find that the people that really, it's the coachability or this growth mindset that really helps people advance. And it's funny because you would think that really having the natural ability is really probably the easiest thing, right? And that's the best thing, but it's really the coachability that's going to help you long term. And I think that's actually the easiest way to learn, and or the easiest people to teach are those that are coachable and that can take input and then make themselves better and be able to implement what the feedback they were given. So like people, for example, people that are natural, are natural surgeons, if they aren't coachable, they really just kind of plateau. They may be good and they maybe will be fine throughout all of residency, but they're not really people that take feedback well, and they're not gonna get better. And but they will probably do fine. But the people that are maybe not as skilled, but they're coachable, they grow a lot. And it really helps them, I think, long term to really be better surgeons, maybe understand the surgical skills better, maybe understand the techniques better. And I think they really do the best in the residency training skill set.
Yeah, absolutely. And I think a lot of us out there who are in the same sort of training years or training periods of our lives, it's also on us to make sure, that you're finding ways, how can I be more coachable? And I think that is something that it took me a little bit to figure out. How can I communicate what I need to figure out from what my clinic's telling me back to them so that we both can understand that the feedback they're giving me, I understand it, I'm receiving that, and now I can kind of think about it at home before the next time that we're back together in the OR. So definitely, like Dr. Huxell said, we'll talk more about coachability a lot here going forward too. Another question for you guys. Based off where you are, for those of you who are in training, what's your access level to practice space in terms of, surgical microscope, simulated eyes? Do you have like an IC surgical simulator for those of you who are familiar with that? Do you have access to cadaver eyes? Just want to get an idea of everybody's sort of access to what they have in their training institutions. Okay, so actually here, pretty even split as well. Actually, a majority of people do not have access to what we would probably in the United States consider sort of our regular, um, exposure to, microscopes, surgical eyes, simulated eyes, and stuff like that. So I'm glad that we have this idea because, and based off where you are, I want you to understand that there's always something to do, something that you can do that hopefully gives you an opportunity to improve your dexterity. So, yes, it's an amazing thing to have a wet lab. It's an amazing thing to have a simulator. It's an amazing thing to have these resources, sure, but I don't think you need that. And I can't say that I have gone through my training without that stuff. I've been lucky enough to have simulation space at my institution, but I do think at a certain point, it becomes more about like thinking about the techniques and thinking about the actual maneuvers themselves too. It's not just with your hands and how can you simulate that. So I actually have a couple ideas for you as who don't have access to simulated space. And these aren't just like new ideas I've come up with. These are things I've heard from other people too. But one common one is to actually, if you have access to like just a microscope in general, just taking a piece of rice and trying to practice writing your name on it. What that does is that allows you to kind of get that feel of being at the scope, looking straight ahead, but just getting your hands underneath the microscope, which is actually, I think, the most important thing. It's just mostly getting that coordination of your eyes, your hands to be working in the space in that position, and that just using these fine motions to kind of do something. And it's so much about your fingers, not your hands and your wrists or anything like that. It's so much about dexterity of your fingers, and we talk about microdexterity. Suturing is a really key part that I think I've kind of bought into, and I think actually looking back, like if you don't have an access to a simulated eye, you can suture other things, and people have recommended suturing grapes. But I think the idea of just suturing anything in general is good because no, not often do you do suturing in your standard cataract surgery, at least in our part of the world. But the idea of suturing allows you to get both hands active, both hands moving, and that allows you to kind of get that sort of opportunity to kind of use your non-dominant hand as well. And I think that's actually been something that has kind of at least helped me get more confident. I just started suturing a lot and under the microscope. Um, but again, you don't need a microscope to suture, right? So if you don't have a microscope, you don't have access to a microscope, try anything. If you have surgical loops that you use, just suture something under your loops. If you even, let's say you don't have loops, just getting your hands, two hands working together, I think that's even ideal. This is something I got from one of my attendings. This is Dr. Han, one of our retina specialists at the university, and he kind of showed me one time just the idea of taking a pen and just rotating it in a single axis. And what that does, actually, it's very similar to certain parts of cataract surgery. When you have the phaco probe, you do have to rotate to get a piece sometimes with its followability to come towards you. So get an idea of, if you're just walking around or you're at home thinking about something, just have a pen with you, try to rotate that pen in the same axis. And I think actually that allows you to get an idea of how your fingers can kind of be moving in cataract surgery or other ophthalmic surgeries in general. Dr. Haugsdal, anything else from your recommendations that people can maybe have, maybe people can kind of think about if they don't have access to a simulation space?
Yeah, I think those are all really great ideas, but I think, and like you kind of said, just doing something is far better than doing nothing. And so if you don't know what to do, just make it simple. We don't have to make it complex. So like one thing is like what is our goal? Let's talk about what our goal is. If our goal is just to kind of improve our microdexterity, some of those things that you mentioned are really good. If our goal is like getting better with our second hand, right? Like maybe try eating with your second hand, right? Or like trying to do things to strengthen that non-dominant hand a little bit. And I think overall that then ends up helping you in the long term. Or there's a lot of people like to focus on really big simulation efforts. So like using the icy, and that's like a really nice tool. But sometimes I say some of the best things about the icy is just the actually skills where you have to learn how to move in the eye. So I don't know how many people are familiar with it, but there's like two sets of it. There's like intraocular surgery skill set, which is talking about or where you actually practice doing Rexi or quad removal or divide and conquer or cortex removal or whatever. And then there's another set where you're actually just improving your dexterity. There's like anti-tremor training, there's moving in the eye. And sometimes I think that's almost better because you're focused on actually like you're just focused on that task. You're not focused on, oh, did I do the rexus right? Did I do that? Plus, did I move in the eye right? Plus, did I keep the eye centered? In fact, when you do just those small tasks where you're not focused on the actually technique, you're actually just focused on like microsurgery, right? And like, how do I move in the eye? How do I keep the eye centered? How do I not? How do I make that small movement without having to move the eye around a lot? Or I think it just changes the skill thought process. So making things really simple in that thought. Anyway, so I share that example so that I can tell you that anything helps, right? So like if you just practice like that pen rotation, right? Like moving that pen in your hand, and then even trying to like move it up, right? Or like moving it around and trying to keep the ball maybe still, but like trying to like move the pen up and down, right? Or like doing even you can buy little things like a table mounted magnifying glass. So you can get they're like probably about this big around, and those aren't really expensive. But you can get table mounted magnifying glasses with maybe a lighted ring around it. And then that gives you a 3D view. And that can sometimes even be enough to do microsurgery under. So you don't even need like a full on microscope. But then the nice thing is too, we can use our OR equipment, right? We could also just take things to the OR. So one example is that we use these simulis or these artificial eyes, which are not biological tissue. And so they're safe to bring into our ORs. And that's kind of nice because then you don't have to worry about purchasing equipment or instruments, and you can just practice there in the using that OR equipment. And that's nice too, because that's in your environment. That's where you need to feel confident. That's where you need to feel like your skill development is really good. And so I'm going to just transition real quick because there was a question about what are the basic needs in starting a simulation wet lab. And I think really there's this push again to think really big about it, having an IC simulator, having microscopes, having stations, equipment, supplies, and all that. But I think you can really simplify it, and you can say, well, let's buy these table mounted magnifying glasses that have a lighted ring around them. Let's get some instruments, which could be used instruments from the OR that maybe aren't ideal, but they are pretty decent for doing that. Or you can get disposable instruments that can be reused that actually do really well or hold up really well long term. But I think you need maybe at least some kind of instrumentation, maybe some sutures, maybe some, if you can get some kind of microscope type thing or magnifying glass type thing. But I really think just doing anything, even if you don't have a microscope and you just have instruments and you throw a bunch of sutures in a artificial, tissue, like even like a cushion or something, like I think that is better than nothing. So I don't think we need to like say that you need to do a lot or have a lot. I think it can be very simple as just doing something, right? With the idea that you're growing, right? The idea that you want to be better. So I think that's what I would suggest is just doing something. And there's so many ideas out there like what that means. And I don't think one is right. And I think there's a lot of right answers on how to get better.
Totally. Well, like I said, like we were saying, you guys are different places across the world. We understand that, but absolutely all of us can find something to work on. And just one example for me right now, for example, I am at our VA here in Des Moines, Iowa, and I'm just practicing chopping more and more. And so I just took a chopper. I've just taken the instrument itself, one extra one we have laying around, and I just try to hold out my left hand as much as possible and kind of maneuver with that. So wherever you are in your stage, you can always think about something that even outside the aura that just gets you more comfortable. So keep that in mind. So how do you switch then? This is our next topic, really that simulate from the simulation stage of learning to when you're actually doing, like we said, surgery on live patients, right? And a huge part of that, I think, is really visualization. So say let's say you're in your first, it's you did the day before your first live surgery with your attending, right? If you're lucky enough to have an attending watching you, which is a privilege in itself. Visualize every step of that case, right? I mean, let's take a standard cataract surgery, standard phaco emulsification. Um, just going through each step in your head before the case, the night before, thinking about that, think about it going well, think about everything going the right direction for the cataract to come out, for the patient to have a new lens, and for them to be doing okay. That in itself is considered success, right? By a lot of our margins. And how visualizing that? Why is it important? Because you're gonna be nervous, and it's a good thing to be nervous. It shows that you care, and especially for a patient in the real life setting. But if you can visualize success, if you can visualize things going okay, then I think that can allow you for those first crucial 10, 20 cases to at least feel like you can kind of at least learn from the steps, which is kind of the main point, right? Is to make sure that you feel comfortable with those key maneuvers and at least feel like you can get in the eye and feel like you can do something of safety and value. Another thing is just throwing sutures like we were talking about, right? So if you have access to a microscope and you have access to some sutures, I think it's a really good goal. As someone told me, and I've tried to really aim for that goal when I first started doing cases was to try to do 1,000 sutures of just 10 nylon in a simulated eye. Now again, like we were talking about, that takes if you have access to those things, but like we were saying earlier, try to do anything. If you could do 1,000 sutures on anything, doesn't even need to be under a microscope, doesn't need to be on a simulated eye, just doing 1,000 sutures, I think you're going to feel more confident just going into your first few cases, just to feel like, I've done something. Because if you did 1,000 of anything before that's somewhat similar to the actual act of what you're going to be doing, you're going to feel a little bit better. You're going to feel like, okay, I think I have the ability to do this. I should be able, I may not be amazing at it when I start, but I think I can at least get something out of this practice time that I put in. Just feel like you're a little bit prepared, and that can help you a lot in just terms of your mentality. Another thing I think has been huge and is really important, especially actually, I feel like it's actually really pertinent to me right now, and I want to share with you guys, is really this idea of just slow is smooth. So moving slow, whether you're in the beginning stages of learning surgery or maybe you're towards like your last couple 50 to 100 cases maybe in your residency, if you're going slow and you're focused on being smooth, slow is smooth. So, by focusing, let's say you're in your seventh case ever, you have to think about going slow, I think, in my opinion. I think looking back, I would tell myself this, like just slow is perfect because your number one goal is to not create any issues for this patient, for this case. And everything, there's no rush. This is your first time. There's nothing to prove here. There's just about safety and just making sure this goes okay. You can prove things to yourself, but it's not important right now. Um, and so by going slow, that allows you to focus on the motions, get used to things, making sure you're not doing anything risky, nothing that you're going to do that is trying to, be too inventive. This is not the time for that when you're just starting off. So don't try to be that person. And even when you're a couple hundred cases in, sometimes it's still good to keep in mind that there's no rush to get through anything. That's being in a rush is dangerous and it's not safe and it's not good and doesn't make your skills really better. So that's something that it stays with you, and it's a really important part of training, I think, as a resident or wherever you are in your ophthalmic journey. We were talking about this a little bit earlier, but really just how do you become coachable, right? A large part of being coachable, if you have an attending who's staffing you, who's guiding you towards a step of surgery, they're spending time investing in you, their expertise, their knowledge, their experience, and that is a huge part of operating and being able to receive feedback and then show that in real time. If someone's saying, "Hey, move to this area, use your wrist, move your shoulders are too high up," or may bring the eye towards you back. You have to be able to be in a space mentally where you can receive that, hear that, and then act on it. And that's not as easy to do as you would think, especially when you're super hyper focused. If actually sometimes you need to be able to kind of understand that in surgery when you're being staffed, I think as a trainee, it's so easy to be so locked in. But if you can just at the same point take in information and then actually follow up on that information in time, that's going to make your coachability so much better in real time. And it's going to make you better. And then you can even, if you're able to review that later by way of video or something, if you're lucky enough to do that, then you can kind of see, and when you're more, when the excitement's gone, to kind of review that and see exactly what you did, and that can be good for you. Something that I do, I actually have like a notes app in my phone. It's called just cataract surgery notes. And I have dates for every case that I've ever been staffed, and I've just written down uh, like everything that I just remember in real time from the cases that day. During this part, attending said this, make sure of this for next time. And it's funny because I think if you do that, you'll see how that changes over time. And it changes over the years. Like it'll become about very nuanced things as you go farther down. And I think it's just good. It's fun because it kind of shows you where you've come from, but at the same time, it's something that you can always refer back to, and that's going to be really valuable because, if you can have just something to take notes on, you're going to need that stuff not just for residency, but probably later too. So it's always good to have something that you can refer back to about a case or something where you receive feedback once. That's going to be something that you can always use in your and keep in your tool set, I should say. And then just lastly, one of the things I think about is just reviewing your cases as much as you can. If you're lucky enough to record your cases and look back at them, I think it's just pretty much part of the surgical training experience is reviewing that stuff. Otherwise, you're not going to really learn about what you're doing right or wrong and what you could do better. And if you know, if let's say that you can't record your surgeries, right? There's no ability for you to record to your institution or where you're training at. There's so many good resources such as Cyberside and Orbis and what they've been doing. And if you're able to get online, you can review other people's cases. That's what, websites like Cataract Coach or Cataract Surgery for Greenhorns. There's so many types of video channels out there that are teaching us, people who are in this stage of our journey, how to really maximize from other people's surgical cases and how to learn from attendings who are reviewing in real time those surgeries and giving you feedback so you can try and incorporate that into your cases. So there's always something that you can review is my bottom line that whether it's your cases or someone else's cases that can make you better. Dr. Haugsdal, any thoughts on any of these things?
Yeah, these are all really great points. Going off just that last point that you were talking about reviewing your cases and cases of others. I think that's such a great point, is that it's not always your cases that can be really beneficial, but it can just even be cases of others. Like that was like you watch somebody that's a really great surgeon and how they operate, and that you can pick up new things, but you can also try to compare it to what you currently do. We always talk about that in some rotations, some of our residents get some observation in addition to doing their own cases, and so they get this idea of like seeing this attending surgeon operate one case, and then the next case they have a case, and it kind of goes back and forth. And that's actually a really great learning rotation because I think they get to see how someone else operates as well. And then there's other rotations where there's less of that observation role, and I think there's a lot of growth that can happen there. But I think there is some growth that is done from an observation standpoint as well. But I also think that when you're watching like videos or surgical cases, I think there is some passive video watching that can occur versus active video watching. And what I mean by that is like, if you're watching a video, especially if it's of somebody else's, it's not just like your own case and you're reviewing your case, but if it's a video of someone else, it can be helpful to have this thought about being active. And like, if that were me, how would I do that? How would I make my hand do that? Right. So like if I'm watching a video and I'm thinking about, well, their left hand's doing that. How do I make my left hand do that? Right. Or how would I have to tilt the eye if this was exactly my surgery? And I think thinking about it that way is a very that's how you grow, right? Sometimes this passive video watching, it doesn't really, it's nice and it's kind of fun and entertaining, I think, but it also, if you're really watching videos to get better, I think there needs to be a component of the active video watching. And I've told residents before that, like, if you watch a video, watch it many times, but every time you watch it, focus on something else. So focus on hand positioning one time, right? Like, what would my hands have to be to do that? Focus on technique and how the eye is centered and how, like what they had to do to keep the eye centered, or just focus on the right hand, right? One time, focus on the left hand the next time, focus on depth and or even microscope movements, like how did that person have to adjust the microscope or focus down or whatever. So every time you watch it, focus on like even just one thing. You don't have to get everything from that video one time, but be an active watcher or be an active participant in that video and try to get something out of it each time you watch it, like even if it's just one thing. So that's one point for that. Sorry, were you going to say something?
No, disagreeing with you. Disagreeing.
Yeah, yes, good. And then going back, we've talked a lot about the slow is smooth together. And I think that's such a good point. Every action doesn't have to be quick. And especially if you're talking about you want to be faster, it's not the technique or that step that you need to get faster and do faster. It's about doing it smooth, right? And if you do that smooth, then that's how you become efficient, right? Like, it's just being smooth and doing it controlled. It's not trying to be quick and move along really fast. It's all about being smooth and slow, and that's how you get to be efficient, and that's how you get to be your cases to get to be really, I don't want to say quick or fast, but that's how you cut down on your OR time. And it's the in-between steps that help you kind of cut down on that as well. So like asking for instruments ahead of time, or not, figuring out how you can, when you're getting instruments, how that can be quicker for you. It's not necessarily that step. That step shouldn't change. It should only become efficient and smooth. And that's how you really, I think, progress, is if you focus still and keep those steps the same, but just work on being smooth in that. That's really the key. And then I agree with that, the 1,000 sutures prior to the first case thing, although it maybe don't need to count exactly 1,000 sutures. I don't know, that'd be very cumbersome, but I think the idea is really good. And I've told residents before that, they want to get better at, the Rexus or something. And, to set up a Rexus station in a wet lab can be really overwhelming. There can be a lot of burden to set up and getting OR time or whatever, or getting the space and then getting the supplies and getting everything all kind of set up. There can be sometimes to do some of those simulations, it can be a really large hurdle. But like suturing, if we know exactly what we need to do that, and we have everything kind of set up in a way where the supplies are relatively easy to grab, you can just pass one suture and then you're done and you've got one suture done. So I always tell the residents, like, if you are on call and you have X amount of time and you were like, well, I'm going to work on something, but I don't know what to work on, just do suturing. Just do suturing. Like, that would be great. That's going to make you better because you're working under a microscope, you're working with your hands, you're going to get better because of all the things we already talked about on the previous discussion point. But that's going to it's something so simple that you know exactly the supplies you need. Just throw a suture and then you've done that one thing. You've made yourself that much better. It can be so simple. It doesn't have to be an overwhelming process to do simulation.
Awesome. Thanks, Dr. Haugsdal. All right. Well, moving on, just want to ask a question that I think hopefully we'll get a really good discussion on. And how many of you guys have dealt with imposter syndrome? Have you ever felt like, man, no one understands this, but I have like snuck into this spot I'm in. It's a total joke. I don't know how I got here, or I don't know how I've become a doctor. I don't know how I've become a surgeon. Oh my goodness, I don't belong here. How many of you guys have dealt with imposter syndrome? And it looks like about 50 people, 50% have, 50% haven't. So, for those of you who haven't, I envy you because I've definitely had it and I still have it. I mean, there's definitely days where I feel like wow, how am I in this position or how am I even, other people are way better than me. I don't have any idea how I got to this point. I don't know if I'm going to be good enough for the next part. So, and I think it can be a really challenging thing to think about in training, and it can actually really halt you, and it can really be something that holds you back from actually being your best self that you didn't even recognize. So, what I want to say about imposter syndrome is a couple things. Number one, it's so easy. You've been told this before, I'm sure, but especially when you're learning surgery, in the context of learning surgery, there's absolutely no reason to compare yourself to other people who you feel like you have to, um, don't worry about other people, for example, in your class and what techniques they're learning and you're not, or don't worry about how many cases they've done and how many cases you've done. There's no role for that for in terms of how you're going to be able to serve patients for yourself. Like that's just a matter of the environment you're in right now, but that doesn't really do a whole lot for you and just holds you back from actually maximizing your education. But at the same point, I think some part of imposter syndrome is kind of driven from an inner desire to be really good, and that's a good thing. So striving for excellence is something you should recognize as maybe part of your imposter syndrome. It's because you want to be really good at something. So be proud of that, right? I mean, this is a good thing to be proud that you want to be good at. It's a good thing to be that you want to be a good surgeon. What's the harm in that? That's a good thing. But it shouldn't come down to the detriment of you feeling like you're not good enough, and you can't that other people are better than you, or you're the only one who has complications, and everybody else makes things so simple. And there's just no need. You're just holding yourself back. And I would tell myself this going, my beginning self, like you're gonna get to where you need to be, and just trust that. We talked a lot about coachability, but really the good thing about being coachable in my experience is that it just makes you really confident. And you want to find every ounce of confidence that you can get, especially when you're learning something like surgery, because that's going to help you feel like when you're in a stressful environment or things are not going as unexpected, you have the skills, you have the ability to get the job done, right? And that just makes you feel like you can continue to grow and that you're in the you chose the right thing, right? Like this is not a mistake. You're in the right field, that you are where you need to be, and maybe it gets rid of some of your imposter syndrome. So confidence kind of gets that away from you, which is good. So look for confidence. And why does coachability give you confidence? Because when you follow through on the time and investment that someone who's teaching you is giving you, they're going to be giving you more advanced things to do. They're going to trust you more. They're going to make you're going to get a better experience out of that. And it's just going to make your working relationship with the people who are training you better. It makes it more fun. And that's all good stuff to know. The other thing I want to just to remind you all is that you're going to be good at certain things. So just keep that in the back of your mind. Don't just constantly berate yourself at things you're not good at. There are going to be parts of surgery, for those who haven't done it, where you're just like naturally good at those parts, and that's good. So just keep that in mind. And then just lastly, because we're just running a little bit short here, is just find people you look up to and pick their brain and try to emulate them and try to find someone who you feel like that's how I want to be when I'm in the OR. I want to be like that person, that sort of aura they give off, or that sort of just the comfort they make people feel, or the confidence that they have with their hands, or the way that they are kind but efficient, but they know exactly what they're good at. Try to find people that you feel like fit your values. I think that's important, so that way that you can kind of have someone to look up to, and that will hopefully get rid of just looking at yourself the whole time, like what you're not good at. So, Dr. Haugsdal, anything about imposter syndrome that maybe you feel like is really important for trainees to know?
Um, well, um, I think it's important to know that you're not alone. That I shouldn't say everyone. There's a lot of people that have imposter syndrome, and I have imposter syndrome even right now. I have imposter syndrome right now. I feel like there's no way I should be on this webinar talking about this stuff. But but I do. I work hard at this stuff and I do this stuff. And so I have to remind myself that maybe I'm not the expert, but that's okay. But I love this stuff and I love doing what I do. And so why not? Maybe I do belong here. And it's not easy to overcome the imposter syndrome, but to note that it does get better with time. And I think understanding that other people have it too is helpful. And I guess I don't. I think if you understand those 2 points, I think that it's important to understand that imposter syndrome can get better, and that other people have it too.
So there you go. There's even attendings who still, have it every now and then. So that should make you feel like you're not the only, you guys aren't the only ones out there. We're not the only. All right. So just want to know out there, anybody and who has done surgery so far, have you had a complication? And you'll see that the way I ask this question is not just a yes, no. So we'll talk about that too. All right, looks like a majority of people have had complications as primary surgeon, and some people haven't. But again, so that's important to keep in mind because it's not that they said no, I've never had one. You're gonna have one, so that's just important to keep in mind. So how do we deal with that, right? That's a really important topic here. So if you're doing surgery, as many of you heard the saying, is that you're going to have complications, right? It's just a matter of just doing something as invasive as being, performing an active surgery on another human being. There's variables when it comes to patients. There's variables when it comes to environments. There's variables when it comes to you as a surgeon and the day and just how things are going. And then that's just going to happen. So we have to accept it. We have to know that that is part of the what we have signed up for. And how do you deal with that, right? Because it can happen at different times. It can happen. Maybe you have complications earlier in your training, and then you kind of don't have them anymore. And great. That means you learn from them, right? Excellent. That's perfect. But maybe you start having them, interspersed, or maybe you didn't have very many in the beginning, and then you have one later. So it's all about dealing with a different mindset or a different sort of how do you sort of learn from that based off the training time in your training where it occurs. And that's important to keep in mind. And so, it's not that if you're feeling good, like, oh, nothing's happened for me for like cases now. I've been pretty good. I'm feeling good. Like I feel like I'm pretty good at what I'm doing. There's an importance to staying humble and the fact that you're something I'm trying to live by now is that you're not as bad as you think, but you're probably not as good as you think too. So try to stay in that medium level of just like range of how you see yourself. Don't think you're too good. Don't think you're the worst person in the world either. Just stay in that medium range, and you'll realize that things can happen on good days and bad days. What I think is really important, as you can see, here's a picture of Rafael Nadal. This is when he won the Australian Open 2022. But is really important to just stick to a routine, I think. Nadal is really famous for he does everything exactly the same every time. Some of his maybe his on-court things he does are a little weird. Like he sets up water balls a very specific way. He always tugs at his clothes in a certain way. He has to walk behind the line after every point. So he has these things he does. Yeah, they're a little bit of ticks, maybe you could call them, but to an extent, keep sticking to a routine keeps things the same every time. And if you can keep things the same, then you'll keep things standardized. If you keep things standardized, hopefully you don't have variables that lead to complications. So that's the thing I think is really important. And so the last point about Nadal again is that next point mentality. He's a master of, washing away what just happened. Or maybe he's 2 sets down and break down like he was in this match, and he still won the match and he won the championship at like 35 years old. And so just focusing on what you're doing right now. So say you had a complication in your last case, you have 5 more cases that day. You have to be able to channel that out and focus on the next one. And it's so easier said than done, right? But you have to find a way, whatever that works for you. I want you to think about it, but think about how you can find a way to just zone into what you're doing next. Because you can think about it later, you can feel bad about yourself later. But once the patient is safe, you got to keep moving for other people. So, Dr. Haugsdal, in your experience with residents dealing with complications, anything in particular you try to tell them, especially when it's early on or even later on?
I think it's really easy, when there's a complication to really get down on ourselves and it can be hard to move on. And that is probably a very important skill to try to learn how to overcome, as you kind of mentioned, having that next point mentality. And it's hard. It's very hard. But I think it starts in your training when you start to see complications, and in our program, a lot of times when complications occur, attending will mostly switch, take over. And I think at that point, that's an important part to start to refocus and start to think, okay, that happened, but I need to remember what is happening now. I need to observe what is happening now. And I need to take away from this step how it's managed, right? And maybe you come away with that and you don't remember a single thing about how to do like anterior vitrectomy. But if you can start to make that mindset change, that's probably worth that effort, right? Is starting to think, okay, man, that's hard. That sucked. I can't believe that happened. I feel really bad. Okay, but now I gotta pull myself together and I've got to help out now. I need to do the best that I can now, and I'm going to um, try to assist in any way I can, or I need to do this now. I need to do the anterior vitrectomy, and I think that's because that's the mindset you have to start to make, and so you start practicing that. You start practicing that in those situations, and then I think in a way you have to try to segment it and kind of block it out. I mean, of course, take care of the patient in that moment and right after that case. But then as you move forward, you need to kind of block it out and take care of everything else. And then go back and process it, right? I think it's important to process it, but I think there's a point where we have to try to move forward. And some of that, though, that comfort of being able to move forward is also feeling comfortable and prepared for the management of that complication. So that so like you watch a lot of videos on anterior vitrectomy beforehand, or you watch a lot of videos on whatever, or you have done a bunch of suturing, right? Because we don't suture a lot of wounds maybe now. And so you may not feel comfortable with that, but being prepared to do that, or being prepared to put a 3-piece in the sulcus, being prepared for those management things is going to help you, I think, then feel better about your management of those situations and being able to overcome them. And then the final thing I usually tell residents is that the eye heals remarkably well. So we think that, a complication is kind of the end of the world at the moment, and it's going to feel like that. But we have to remember that the eye heals remarkably well, and that usually things will go really well. Now, they might have to have some additional procedures, and they might have to, um, get extra visits, extra medicines, but usually it's going to turn out okay. They're going to do okay. So it's important to keep that in mind.
Awesome. Well, we want to thank you guys. I'm Bilal, like I said, and you guys can email me if you have questions about anything. And these are some of my links for social media stuff. But we also want to spend time with just any questions that you guys have. I have the Q&A here. And it seems like we have a question about the 4 Ps of imposter syndrome. I don't I don't actually know if there's 4 Ps. I don't know of a 4 P imposter syndrome myself, but I guess like we had touched on earlier, I think how you deal with the imposter syndrome is mostly just making sure that you remember things like number one, you're not alone, right? Because people who you look up to can have it. That makes us all feel a little bit more normal. Other things like just remembering that it shows that you care, it shows that you want to be good at something, and that's important too. But so that's what I'd say. I don't know the 4 Ps, but I'll try to look up and learn from those, whatever they are. Question about how much are goat eyes like human eyes to practice suturing or steps of cataract surgery? I can't say I've ever done anything on a goat eye. I've done some on pig eyes. Dr. Haugsdal, any experience with like I guess like animal eyes in general? How much similar are they? Like in terms of like experience for
Yeah, I'm unsure exactly about goat eyes, but animal eyes in general, they're really actually good for suturing. Usually the cornea tissue and the scleral tissue are pretty similar, that they are very good for suturing. They can, depending on, you know, um, when they were obtained and stuff like that, sometimes the cornea is not very clear, but if you're just practicing the act of suturing, that passage of the suture through that tissue is going to feel really normal or natural compared to human eyes. For other steps, like sometimes we do pig eyes. The rexus is a little abnormal. It's more elastic than in human eyes, and the lens is a lot deeper and softer, and it's a little bit less realistic. And that's why some of those things, I hate to say, are really good at simulating that step. But as we kind of mentioned, is like, if you do nothing else, just do something, right? So like if you do suturing on that animal tissue that feels fairly realistic, that's going to be maybe a ton better than trying to do a rexus in a goat eye or a pig eye, because maybe that's going to feel less realistic. And how beneficial that is when it's that unrealistic is it's hard to say. But suturing, it's relatively easy thing to do, and maybe that's going to be good enough. I think that to answer your question, I think suturing, it's probably the best, most realistic.
It looks like we've answered most of the questions that I see in the chat. What I'll do now, I guess I'll just go ahead and stop sharing. But want to thank you guys all for coming and joining us for this awesome session. It was a pleasure to get a chance to talk to you. It was a pleasure to have Dr. Haugsdal give us her expertise, and I really appreciate all the training that she's done for me and others. And you guys can always, like I said, contact us, and you have my email. Like I said, I can also put that in the chat for those who need it. But we really we really care about the experience for you guys surgically. It's important for all of us. Remember, you're going through it. I understand. I'm going through it too. And hopefully you look back on this session and feel like you can refer to things on the CyberSight website when you're going through different parts of your training. And we really appreciate you guys taking the time to be with us wherever you are across the world. So have a great day, and thank you very much for being on.